In our practice, we have two ways of resetting your brow so that it looks bright and happy but not overdone. One is called a temporal lift. And a temporal lift is about taking the tail of the eyebrow and lifting it a little bit. And we use that oftentimes with our facelifts or with our upper blepharoplasties as an adjunct surgery. What we do is we make a little incision behind the hairline. It's a little access incision. We don't shave your hair. We don't cut your hair. And it's just an access, and it allows us to go into the deepest layers and lift from the tail of the eyebrow to the cheek here and put in a couple stitches to lift that brow up. Again, it's not a brow lift because it's not doing any of this, but it does smooth out the skin of the temple area and lift the tail of the eyebrow up. It's a great procedure. We do it often. It doesn't require any staples. It's just stitches and looks wonderful. Sometimes we need to fix the heaviness of the brow that's a little bit more in the center of the eyebrow or the inner part of the eyebrow. And that's where we do an endoscopic style 4-point brow lift. It's the same as the temporal lift, same incisions here and here, but now we're going to add 2 more access incisions. One along the hairline here horizontally and one here. They heal great because, again, it's an access incision. We're not cutting out skin, so there's no tension. So what we do is through these 4-point access incisions, we can go deep and lift the eyebrows off of the connections to the bone that are pulling that brow down hereditarily and with aging. And we release that brow, we weaken those attachments, and your brow is naturally going to lift into a better position. Once it does, now we can suture things back into place, not trying to tug it as high as it can go, but to put it and secure it into the position it's passively lifted into. So it's more of a passive brow reset than a brow lift. Brow lifts can be terrible, right? We've all seen them because a lot of surgeons lift the brows in the center part of the eye straight up and down. And that's not the way the brow ages. When you do that, it'll lift the brows up and give you a surprise look. It'll widen the brows and look fake. But that's not the way we age. We age not vertically in the center of our brows, but on the outer 2/3 at about a 60-degree angle. And that's how we lift when we have those access incisions, is up in that direction. So that's what a properly done brow reset will do. Not over pulled, nothing fake, not to unravel all the skin, but just to get the brows into a position where you don't have to use the muscles as much and things look bright and happy like you did 10, 15 years ago.